Hi everyone, just wanted to go over a little bit from last week and talk a little bit about this week as well. This will probably be a fairly short video. So last week we looked at diverse populations and how health policy can impact diverse populations. And I'll encourage you again to remember that when we're talking health policy, we're talking about public policy. We're not talking about policies within an organization like a healthcare, like a hospital or healthcare system. So what types of health policies can impact diverse populations? We see health departments and government agencies working hard to do different things to impact various populations, and we had some discussion about that through our discussion question and whatnot last week. So I look forward to reviewing everyone's case study assignment. Remember, if you have not already, please make sure that you are submitting or you have submitted your self and peer assessment. That gets uploaded separately from one of your group members will have uploaded the case study, but your self and peer assessment will be uploaded separately as an individual document by each person, and that is how I assess work within the group on a particular topic. So good work last week. I look forward to taking a look at those assignments throughout. So this week in week 4, we're going to continue to talk about health policy. Obviously, that's what we're doing in this class. But we're going to talk about a couple of different things. We'll talk about policy legitimation. And like it says here in this section, this little section here about legitimation, but it seems like it might just be a straightforward process. The policy, let's say it's a law, policy becomes a law, it's voted on by the House and Senate, vote on the same version, goes on to the executive branch, gets signed into law, etc. It's really not that simple. It's so much more complex. And in conjunction with that, one of the things that makes legitimation a complexity is the notion of lobbying groups. So we're going to talk about interest groups in the policymaking process. So interest groups like hospital associations, organizations like the American Medical Association, the American Hospital Association, those types of folks. But then also organizations like the major insurers like Blue Cross and Blue Shield and Humana and United Healthcare and big national insurers that impact people across the entire country. They have massive lobbying efforts associated with them. And then also health insurance plans are, many of them are affiliated with an organization called AHIP, which is America's Health Insurance Plans. They also have a lobbying arm. So lots of folks have their hands in the pie when it comes to policy legitimation with regard to health care. So just be aware of that. And we'll also talk a little about Medicare and Medicaid and their that piece of it with regard to policy. One may think, well, Medicare and Medicaid, they are policy. Well, they're in their root, they were law, and which turned into some regulatory action as well. But the organizations that do the work for Medicare and Medicaid are private organizations in many cases. So, and certainly with Medicare, they are what are known as Medicare administrative contractors, who are private organizations. So in states, sometimes they have state employees working on Medicaid. Other places have that farmed out to a contractor. So those people get involved in that process as well. And so it's quite complex. So we'll learn a little bit about that this week through our reading and through the various readings in the classroom. So the week 4 discussion, we're going to continue to talk a little bit about the ACA. The reason that we talk about the ACA so much in this class is it is the most recent and actually in modern time the most significant health reform law that has occurred. So it's just important to consider legitimation of that law, how it has progressed, the challenges that have occurred, etc. So we'll talk about that in our discussion this week, and that continues to be an issue for us to consider over time. The other thing that I want to talk about is your final project topic. You will be choosing your final project topic this week. It doesn't mean it's written in stone. If you decide to do something else, just please let me know. But I do want you to submit your topic choice to me so I can provide you some feedback on it. So what you will be doing in your final project is writing a policy brief, and there's some information here in the classroom this week about how to develop a policy brief. But you'll be writing a policy brief about a new policy proposal that you want to move forward. So this new policy proposal could be something brand new, something that you think is a good idea that we should be doing as a nation, as a state, as a local entity, like a local city or township or county. And so, thinking about it from that regard, it could be something completely new, or it could be, something that there's already regulation or policies or programs in place, and you think that we should make some changes to them. So this could be new changes to existing policy, but it needs to be something new. It can't just be a discussion of existing stuff. I want you to, be creative and think of something new. If you're interested in, maybe something like children, health of children, then look at maybe state level interventions to help children in need, low income areas, help children make sure that there's appropriate food, look at healthy eating or exercise or school related healthcare things for children. Anything that you can think of that might be a new area. You don't have to do something about kids. That just tends to be a popular one. Kids or elderly people also tends to be a popular one. So think about the areas that interest you. What from a policy perspective is interesting to you, and then think about new policies around those areas, or changes to existing policies around those areas. So this week I'm just looking for 2 or 3 sentences regarding that topic in a Word document, and you'll submit that through the Dropbox in the classroom. In week 6, you'll do an outline. So I certainly want you to kind of get started rolling forward on this, and then your final project will be due in week 7. So this week's just the topic choice, and I'll provide you feedback on that. You also have a regular written assignment this week about interest groups and how interest groups impact organizations. And then we have a quiz. The quiz has not been posted yet. I apologize for anybody that wanted to take it early this week. I hope to have that up later today. So that will be coming post haste. And that's all I've got. If you have any questions, please feel free to reach out. Otherwise, I will look forward to seeing everyone in the classroom, and look forward to seeing your final project topics. If you have questions or want some more guidance on that, please feel free to reach out. Okay, thanks so much.